Studies say that almost 50% of people over age 30 have this. Are you one of them? Well, hello again everyone, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the US. Okay folks, apologies for the clickbait this week, but today I'm going to take a few minutes to discuss gum disease. What is it? What does it look like? What causes it? And why I don't think we give it the respect that it deserves. So perhaps you've had your dentist or hygienist use words like gingivitis, periodontitis, papilla, calculus, pockets, among others, when describing the health of your mouth. But remember, this is Dentistry Made Simple, so we're going to call the whole thing gum disease and be done with it, okay? So what exactly is gum disease? Well, it's the breakdown of the tissues that support your teeth. And that would include your gums, the bone around your teeth, as well as a tiny little ligament that connects all of this stuff together. Well, let's start with what a healthy mouth should look like. For starters, your gums should be pink in color and firm. They should be scalloped with nice points to follow the contours of your teeth. And the gums should be snug around your teeth. And if you could zoom in on the surface of your gums, they would resemble the surface of an orange peel with small dimples that we in the industry would call stippling. If any of these characteristics start disappearing, then we have entered into the early stages of gum disease. Here we start seeing gums that are now red in color instead of pink. The gums are now more spongy instead of firm. That scalloping now starts to look a lot less pointy, and the gums aren't all that snug around the teeth anymore. Your breath may start getting funky, and we start seeing blood in the sink during and after brushing. Now, so far, we haven't passed the point of no return, but if nothing is done to address these observed changes, we start to drift into the more serious stages of the disease, and that means the following. The gums may now appear purple in color. That scalloping is now more like a gentle wave, and the gums start pulling away from the teeth or even receding, creating new spaces for more debris to collect. And the disease starts to break down the bone around our teeth, and that tiny ligament I mentioned earlier is all but destroyed. When this happens, the teeth are no longer anchored in place, they start getting loose, and all of this leads to tooth loss. It's no surprise that gum disease is the leading cause of tooth loss in adults. So what causes gum disease in the first place? Well, there can be a number of factors. There can be hormonal changes. Pregnant women will have bleeding gums. That's normal and typically goes away soon after giving birth. Illnesses such as cancer, HIV, and diabetes can affect the conditions of your gums. No questions about it. Medications can reduce saliva in the mouth, which has a natural protective effect on teeth and gums. You lose the saliva, you lose the protection. But far and away, the most common cause of gum disease is the buildup of plaque due to poor oral hygiene habits. This, in turn, allows bacteria to build up in the mouth, causing inflammation, and the disease starts progressing from there. Now, the good news is that the early stages of gum disease can be reversed, and the later stages of gum disease can be kept from getting worse in most cases by proper oral hygiene and good eating habits. Now, many of you have been hearing about this for a long time now, but it bears repeating. So be sure to get a professional cleaning at least twice a year, but follow the schedule that your dentist and hygienist advises. Brush your teeth at least twice a day using a soft bristled brush and fluoride toothpaste. You can check out an earlier video where I talked about the advantages of an electric toothbrush. Floss every day, and not just when you have something stuck between your teeth. Use antibacterial mouthwashes to combat bad breath and plaque buildup. For you smokers out there, try to stop smoking if you can. And stop eating foods high in sugars and starches, such as junk food and candy, as these are tremendous breeding grounds for bacteria to feed on, okay? Now, I want to end this video by discussing why gum disease is so prevalent in our society, yet it doesn't seem to be taken that seriously, which is a shame. But here are just a few reasons why this may be. First of all, gum disease can often progress painlessly. Even in the later stages, it sort of sneaks up on you, so it's easy to ignore. Second of all, in some people, gum disease only affects parts of the mouth. For instance, only your back teeth, making it more difficult to realize anything wrong is going on in the first place. Third, and for some reason, we've become desensitized to the warning signs and symptoms of gum disease, particularly bleeding gums. Folks, with the exception of a woman's monthly cycle, blood is supposed to stay on the inside. If you started oozing blood from underneath your fingernails, you would freak out. You would be demanding to see your physician immediately for a cure. Yet we spit out blood in the sink and we think nothing of it. And lastly, it's only been fairly recently that research and scientific studies have come to the conclusion about just how interconnected the body truly is. It wasn't all that long ago that medicine used to be rather compartmentalized. It was like, oh, you work in the mouth? I'm down here in the foot. Okay, have a good one. That's just not the case anymore. Studies are starting to suspect that damage to gum tissue in people with gum disease may allow germs to enter the bloodstream and cause damage to blood vessels elsewhere in the body. Furthermore, ongoing inflammation from gum disease puts a burden on the rest of the body. It's all connected, folks. So please take gum disease seriously and follow the instructions from your dentist and hygienist to the letter, as your dental health is their top priority. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a question or comment as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.